Welcome. My name is Noemi Guevara, and I am the Director of Alumni Engagement at California State University, Long Beach. We thank you for joining us at this new edition of our 49er Industry Chat. Before we continue, I want to just let you know this session is being recorded and it will live on our website at csuob.edu/alumni. Also, we encourage you to use our Q&A box located below if you would like to submit any questions throughout the broadcast for our guest speaker today. And now it's my honor to introduce our guest speaker. Michael Durand is a proud Cal State Long Beach alum, earning his Bachelor of Arts degree in political science. An expert in public relations, marketing, and healthcare, he has worked as outside counsel for both large and small biopharmaceutical companies and medical organizations, and has advised clients around the world on advocacy, brand strategies, and enlisting public support for health issues. After 35 years in public relations, he pivoted to education and is currently an adjunct assistant professor in the Integrated Marketing and Communications Department at New York University. Michael was the founding director of Novelli's global healthcare practice, and later was managing director of healthcare strategy and planning for Ogilvy Public Relations. He has directed communications and corporate positions assignments for Amgen, Bristol-Myers Squibb, Novartis, Pfizer, and other healthcare companies, and has advised organizations including the American Medical Association and Centers for Disease Control and Prevention and healthcare education programs and messaging. He holds a Master of Health Communications from Boston University, as well as a graduate diploma from UCLA in Public Relations, and in addition to his BA from Cal State Long Beach. Please welcome today Industry Chat host, Michael Durand. Welcome, Michael.
Thank you very much, Noemi. Great to be here.
Thank you so much for joining us from, I hope it's sunny New York today.
It is. It's beautiful today. Spring is here.
Yeah, spring is here. Well, thank you so much for accepting our invitation today. I just wanted us to start from the beginning. You know, what made you come to Cal State Long Beach? What was your experience like? And then walk us through that transition of graduating and starting in the working world.
Sure. Well, when I was in high school, I grew up and went to school in the Bay Area, Redwood City, and I wanted to get away. I didn't want to go so far as the East Coast, and I had several friends who were going to Long Beach. I went down to the campus with my dad and immediately said, hey, this is the place. I feel really, really comfortable here. Not as big and as intimidating as UCLA, but it just looked like a wonderful place. And I can tell you my experience in Long Beach was nothing short of fantastic. I got, I think, a first-class education in political science, but also in decision-making and how people interact with one another. And I will always remember some of the professors that I had, Professor Erb, Professor Leiter, absolutely wonderful, wonderful people. And I remember them even to this day. From Long Beach, I had initially a job with the public transportation company in the city doing marketing communications. But my boss said, well, what you're doing is really PR. So I thought, what's PR? So I went to UCLA and got a diploma in public relations. But it really was what I've always been interested in. It's like how people make decisions. How do you convince people of your organization's point of view? And how do you organize people to take action? So it really was kind of what I wanted to do. From Long Beach, I got a job with the Muscular Dystrophy Association in LA, working on the Jerry Lewis Telethon. From there, they brought me to New York as the Associate Director of Public Health Education. And I worked in the national office for 3 or 4 years. And from there, I went to the agency world and worked, as you said, for 21, almost 22 years for Porter Novelli, one of the large global public relations agencies, where I established the healthcare practice and had the great fortune of working with companies both here in the United States and really all over the world. And after many, many years, I thought, well, I can, shift down from fourth gear into second gear and do something different. And so the last few years I've been teaching at New York University.
Wonderful. What a great path you've had. During your time at Long Beach, did you, I know you give accolades to your professors. Did you have any mentors, anyone that helped you, guide you to transition or during that time?
Well, I think there are several professors who I really respected. Professor Bill Leiter, who I think just retired or achieved emeritus status just a couple of years ago at the campus, and he was always, I thought, a wonderful mentor. Apart from his courses, which were really rigorous, really difficult, but he was also someone who'd always listen and offer advice. He had worked for government as well as education, and was terrific at talking about how people make decisions in groups. And I thoroughly enjoyed talking with him both in class and outside of class. So I think he was the primary mentor that I had. Mm-hmm. Other people I remember, Dean Swanson, the Dean of Students at the time, wonderful woman. And I know her son or daughter is actually living here in New York. She was terrific, as were many, many other both administrators and professors.
Yeah, wonderful. And something you talked about, you graduated with political science and then you go into this new world of PR and looking for continuing your education with a certificate. Could you speak to that about for our audience to continue to pursue, just learning more about or upping your skills?
Yeah, I was one of the questions that I often get is what does it take to be successful in public relations or marketing? And one of the things I think is absolutely vital is always having, being curious about the world, not just stopping with, okay, I've got my degree, so now I'm fully prepared to, work. Learning new things, both about the public relations and the communications craft, about the area of specialization, whether it's healthcare, consumer packaged goods, but also the world in general. And I think anybody who wants a career in communications really needs to think of it as a lifelong commitment to education and learning. Just parenthetically, I just last weekend started reading William Shire's The Rise and Fall of the Third Reich, a book that I started in my freshman year at Long Beach.
Oh my God.
And I put it down because it was too much for me. So I'm now, after, almost 40, 50 years, I'm starting it again.
Wonderful. Now maybe you'll see it with different eyes.
Definitely.
So I've started to get some questions from our audience today. How did you transition from political science to PR?
It was really a relatively smooth transition. What I was doing for both Long Beach Public Transportation Company and initially the Muscular Dystrophy Association was convincing people to take action. At Long Beach Public Transportation, it's getting people to ride buses. At the Muscular Dystrophy Association, it was getting people to contribute to this important charity. So convincing people to take action was something that I had acquired some experience and expertise in. So from there really into pure public relations was not that big a transition. Learning how to write news releases, pitching the news media, all the traditional things that we did were relatively, I don't want to say it's easy, but it was a fairly smooth transition from certainly the work at MDA. And I just to round it off, as I was leaving the Muscular Dystrophy Association, I ran into a gentleman who ran a public relations firm, and he was one of the first people to do healthcare PR as a specialty. And because I had come from MDA and I actually knew a little bit about medicine, he thought, this guy would be an asset to me. So I joined his firm, and that was I guess the spark plug that started it all.
Yeah, that was your start for everything else that were to follow. What is unique about public relations in the healthcare industry?
One of the unique challenges that we have is that healthcare is one of the most regulated industries in the country. Probably with the exception of finance, it is the most regulated industry. So whereas in consumer packaged goods or electronics or digital products, you can basically say whatever you want so long as it's fairly truthful. Healthcare, particularly in the pharmaceutical and the biotech space, it's what you can say is regulated by the FDA, the Food and Drug Administration. And what you are communicating is really within that circle of what the FDA allows a company to say. So you have to be extremely careful about your messaging. You can't talk about a drug X can work for all people with diabetes if it's only approved for type 1 diabetes, for instance. Or you can't say that a drug will treat all patients if only a subset of patients are actually treated with this particular medication. So that's one issue. Another issue I think that's important is that healthcare is something that everybody feels emotionally attached to. Your health or the health of your parents or your siblings or whatever, that's very personal to you. So that when you read stories about pharmaceutical companies and their profits and so forth, people take that personally. And when they get their bills from hospitals or from their doctors and they see, what it costs for a treatment, people react viscerally to that. So you have to constantly keep in mind how people are feeling about not just medicine or disease, but the people that market drugs as well.
Definitely. It's how you tell that story, how you understand that high level, but how do you bring it down to that consumer, and tell that positive story?
Sure. And the pharmaceutical companies and medical device companies, they haven't been particularly good about communicating that story, telling the story of drug discovery, fact that, we are hopefully at the end of the COVID-19 pandemic, thanks largely to the work of companies like Durand, Pfizer, and so forth. So yes, people criticize pharmaceutical companies for high prices and so forth, but these are also the companies that are quite literally saving people's lives.
Yeah, they definitely are. Very thankful to all of them. You obtain your graduate degree in health. Is that something that's required for someone that wants to do PR in this industry at this time?
No, it's not. When I was at Novelli and hiring people, I was looking for people, as I said, who were curious about the world, people who were great storytellers. You'd be able to not just write a news release, but really be able to tell a story about the development of a medicine or how a drug may impact or affect the lives of people. Storytelling is like hugely, hugely important. And being able to work in teams is important. Public relations is not it's not a solo enterprise. You're always working in teams. So you've got to be able to interact with people. So, the people that I hired, probably easily half of them had no specialized training or formal training in healthcare or communications.
Okay. What did you look for when you were hiring for your teams?
Yeah. So as I said, people that are curious, people that are great communicators, can tell stories, these are people that, you sit down across the desk from them, or, on a couch or whatever, and you want to listen to them. They just are great communicators. And that's really, really important. And obviously they have to write. People that, it's scary when you see people that, can't write an English sentence. You wonder what's going on here. So people have to be great verbal communicators. They've got to be able to write well. And they've got to be able to digest a lot of information, scientific information, and translate that into language that people actually can understand. When I started my career here, I would read journals like the Journal of the American Medical Association with a medical dictionary right next to me. So I'd look at a word, my goodness, what does this mean? So I'd look at the dictionary, aha, hypercholesterolemia is high cholesterol. So, getting that fluency in scientific language is also really important.
Yeah, doing that work or that extra step, it's always important. Another question, did your political science background assist you in advising the organizations as it pertains to the law?
Honestly, the political science background, no, it did not. I didn't specialize in legal issues when I was at Long Beach State. What I did do was do a lot of a number of workshops on food and drug law, and from there I could advise companies.
Okay, wonderful. Was your PR work in healthcare mostly focused on organizations like hospitals or like drug, pharmaceutical?
Sure. So most of my work was with pharmaceutical companies and biotech companies like Amgen, which is just up the 405 from where you are.
Yeah.
And some medical organizations, such as the American Heart Association and the American Medical Association. Healthcare is such a broad field that people in it oftentimes have to sub-specialize. And so they go into hospital PR or working for insurance companies. But my area of interest was actually medicines and treatments to help people.
Wonderful. Biopharmaceutical companies have been in the news lately with the vaccines. How involved are the PR teams when announcements and press releases are made?
Sure. Well, they're the ones that are creating them. The scientists and doctors they conducted the massive trials that demonstrated that the vaccines were safe and effective. But then it was the public relations teams at Pfizer and AstraZeneca and so forth. They're the ones that actually created the news releases, the speeches that the senior executives would be giving. They may help with presentations before the Food and Drug Administration in terms of taking those data and then translating it into information that the FDA can act upon and so forth. So yeah, they're hugely, hugely important. And I really got to commend my colleagues at Pfizer and the other companies that have done, I think, an outstanding job, generally speaking. There was some hiccups, but generally they've done a good job.
They're under the light, right now, because everyone wants to know what's going to happen with the vaccines. But yeah. What advice do you have for someone that wants to work in the healthcare PR industry?
Get their resumes out. So yeah, I think, as I said, if you're interested in this field, learn as much as you can about healthcare generally. So try to learn about diseases. I mean, this is daunting because you can't become an expert in medicine, on your own. But try to learn the basic concepts of medicine and healthcare. Learn about funding, how the healthcare system is funded. This is going to be increasingly important in the next couple of years is like, how are we actually paying for medicines? And then learn as much as you can about communications. How are patients or people who are have a family member with a particular disease or condition, heart disease, cancer, Alzheimer's, and so forth, what are their concerns? What are their fears? What are they looking for in terms of support? And how can you create messages to reach people like that and convince them either to take a particular action or to inquire about a medicine or a therapy?
Right. Yeah, I had read that like opportunities in this field are there's a lot of competition. So great advice on how they could, hopefully be one of their top candidates when they're applying for these positions.
Right. I think the important thing is you've got to be a good communicator. And if you can do that, and as I said, be curious about the world, then the technical information about medicines and healthcare, that is almost secondary because you can learn about that. I can teach people about the cardiovascular system relatively easily. I can't teach people how to be great communicators as easily.
Now it has to kind of come naturally sometimes.
Well, you can develop. I think you can develop the skills and the talent, but you can't do it overnight.
Definitely. What issues like the opioid abuse and misuse do PR and legal teams often work hand in hand to manage the situation and help mend reputations for the pharmaceutical companies?
Okay. I think one of the in the case of the opioid epidemic, if you're working with the pharmaceutical industry, that gets extremely contentious because you have legal issues that have broad ramifications for companies. So it's not just a public relations issue, it's a legal issue as well as a medical issue. One of the things that the communicators have to do is be transparent. If a company has programs to help patients, if the company has, and this may get me into trouble by saying this, but I think companies have to be honest about their marketing. If they've done things that have been not necessarily in the public's interest, they've got to accept responsibility for that. But the main thing now is that pharmaceutical companies, government, insurance companies, we all have to work together to educate people and convince people about the risk of opioid abuse. Opioids are tremendous drugs. They can help people better than any other type of painkiller, but they're not for every patient. They're only for a select subset of patients, and anything else is both dangerous and potentially life-threatening.
Yeah, definitely. Thank you. How would you assess the messaging on the COVID-19 pandemic from a national perspective and in the United States?
Yeah, I think the tragedy, and Dr. Birx was commented about this 2 weeks ago on CNN, that the first 100,000 patients who died, probably there wasn't much we could do. The other patients who died since, and we're going to reach 600,000 patients by summer, we could have saved a lot of those people if messaging had been clearer. There are 4 messages for the public. Wear masks, avoid crowds, social distancing, wash your hands. Really simple stuff. And if those messages had been communicated by everyone, from the White House down to the public health departments in counties and cities, we could have saved a tremendous amount of lives. As you know, messaging, one of the key things in public health messaging is you've got to have consistent messages for the public. And if they're hearing one thing from some people, hearing other things from other people, or people are changing their what they're saying without just cause, people become confused. They basically close their ears, sort of follow what they think is best for themselves, even if it's not necessarily good medical advice. So I think we've had a real tragedy in messaging. We could have done much, much better than we did.
Do you think, though, that you could see in the numbers that the minority population was the one that has been affected the most? Is it because we weren't translating to the various languages that are being spoken in the United States?
The people of color, the minority communities, it's an interesting issue. As you know, vaccination rates among African Americans is considerably lower in most parts of the country than it is the population generally. And the question is why? So, some people say, well, it's because of the Tuskegee experiment back in the 1930s. Well, I don't think that's it. That most people don't think in terms of what happened, 80 years ago. I think there is there is some skepticism about science and authority among certain, not all African Americans or Hispanic Americans, but some that we have to overcome. Vaccines are not a political issue. It's not a socioeconomic issue. It is an issue of health and life and death. And we've got to find the right messages and the right communicators to get those messages out to every community.
Yeah, definitely. I think you have many people like, oh, I'm gonna wait a little bit, and how do you convince them to say no? We need to.
Well, it's like waiting potentially could be fatal.
Right.
And if we can't, everybody from the extreme left to the extreme right, everybody says they want us to return to normality. Okay, the only way we do that is to get the rate of infection down, and the way we do that is by vaccination. Natural herd immunity is not going to do it. We've got to get people vaccinated, and we can do that. Then we can go to, we can have our commencement on campus. We can go to, concerts at the Civic Auditorium. We can do all the things that we want to do.
Right.
But got to get people vaccinated.
Definitely. What's your perspective on how pharmaceutical companies are managing their message on the prices of drugs? How could they improve that message?
Yeah. So the message that the pharmaceutical industry has crowed for the last 30 years has been that drug prices are high, largely because we have to fund research, and we are building in the cost of research. And the industry's been saying that for literally 30 years, and people aren't buying it. So ask yourself, in what other area would communicators be saying the same message over and over again, and it's not being accepted, but they just keep saying the same thing? That doesn't work. So what I think companies need to do is really focus on, one, what the pharmaceutical industry has done in terms of helping, your neighbor down the street, or your mom or dad or aunt. Okay, these people are alive; they're living healthier lives thanks to the medicines that they're taking. Two, and I think that's a very visceral message people will get. The second message is the risk involved in the pharmaceutical industry. If Microsoft or Dell makes a product that is really kind of clunky and not particularly advantageous, it can still sell that product, and it may not make as much money as a killer app, but still make money. Pharmaceutical industry, you have to invest hundreds of millions of dollars in research before a drug is ever approved by the FDA. And there's a high likelihood that that drug will fail in its clinical trials and not make a penny for a drug company. So there's tremendous risk there that companies are taking that the public simply doesn't understand. And it's a tough message because, you know, people, I don't know how well that would be received, but it's, I think, a more powerful message than simply you're paying for the cost of research.
Definitely. Thank you for that. Will the Biden administration succeed in expanding Medicaid or Medicare, in your thoughts?
Well, I think the good news is that even in some conservative states like Utah and Alabama, the state governments now are looking at expansion of Medicaid. Okay, so previously, some states were reluctant to expand Medicaid because of the cost. Now they're, I think, starting to realize that they really can't afford not to have people covered for healthcare. So yeah, the Biden administration is going to do everything it can to encourage states to expand Medicaid. But I think the states are moving along on their own. I think in terms of Medicare, which is the program for older people for the most part, I think the Biden administration recognizes that the Affordable Care Act, Obamacare, wasn't the end of the road. It really was. It's a terrific program that helps millions of people, but we can do a lot better. And there's lots of proposals to do that. I think it'll be more an evolution rather than a, you know, snap your fingers and everything's going to change. But I think we're going to have a system, I hope we'll have a system that's much more rational and offer greater care to more people in the near future.
Which is key at this time. To change gears a little bit, how did you make that transition from practicing public relations to teaching integrated marketing and PR? And you know, you've taught at NYU, Harvard Extension, Boston University. Why those universities?
Because they gave me jobs. Yeah, no. You know, it was one of those things where it's half design and half luck. I always thought, well, you know, my career will be in three phases. You know, I'll work for industry or for agencies, I'll become a consultant, and I'll end up teaching. And I just sort of thought, well, that makes sense. And as it happened, I was at a party a few years ago, and I mentioned to a friend of mine, a colleague, you know, I've always wanted to teach, and he teaches at NYU. And he called me the next day, breathless, and said, "Hey, call the dean. They're in desperate need of somebody to teach a public relations course at NYU." So I called him, and we met, you know, a day or two later for coffee, and lo and behold, I got the job. I knew nothing about teaching. And I thought, well, I'll have, you know, all summer to, or actually it was in the fall, I'll have until, you know, January to learn about this. And they said, no, you got to start in 2 weeks. Oops. So I really had to develop my syllabus quickly, and it was a little scary. But I looked at teaching as I had done a lot of new business presentations when I was at the agencies, where you get up and you talk to skeptical prospects or clients. And I looked at teaching very much the same way. You know, this is, you know, you got to impart information, but you also have to do it in a way that is entertaining and involves the audience, getting people really engaged in what you're doing. And then I realized that really, you know, a course that's 2.5, 3 hours long, you don't have to, you know, speak for that long. You can do exercises, you can do simulations and games and things like that to get students much more involved in, you know, practicing what you're talking about. So after a while, it became much easier.
Yeah, I love those interactive classrooms. They're just
Yeah.
interesting. I think you learn more. Um, and teaching integrated marketing, what other courses do you teach?
I teach a course in strategic communications, course in the history and theory of public relations, and beginning this summer, media relations. That's my core course I've been teaching for years. And then beginning this summer, I'm going to be teaching a course in crisis communications in the regulated healthcare environment. So, how can companies communicate, but also be mindful of the FDA and the SEC and other government regulatory bodies and so forth. So I'm really looking forward to that.
Oh, that sounds very exciting.
Yeah, I'm very excited.
You talked about, how you got into teaching, and it talks about that network. What advice do you have for our audience in building network and associating with people, that are in your field or that could introduce you to potential people that could give you your next opportunity?
Yeah, well, I think anytime you're in groups of people, you'll meet people that are interesting, and I don't want to say they can help you, because you really should think more about people as people, not
Right.
resources. But when you meet people, don't be afraid to ask them questions, or ask them, well, I'm interested in this field. Could we Zoom maybe tomorrow for 15 minutes? Or, when we get back to normal, can we have coffee and sit down and chat with people? You'd be surprised how many people would be receptive to that. So, networking it's like prospecting for gold or so forth. You go through a lot of individuals, but you find a few who really are extremely valuable and can help you.
Yeah. Yeah. In these chats, I've heard many times about, finding someone that you want their job per se, and you ask them for an informational interview, which I think is a great idea because you get to learn what their day-to-day is like.
Right. I interviewed a woman last week who, it's one of those things. She was recommended. Another colleague of mine interviewed her on the recommendation of somebody else. My colleague recommended she talk to me. And I had a lovely conversation with this woman who's just graduating, I guess this spring, from Georgetown. And I recommended her to somebody else. So it's like, pebbles in a stream or so forth. You hop from one to the other like a frog. Right. And I'm absolutely convinced that at the end of this, she'll get a job somewhere.
That's wonderful. Did you ever join any clubs that help you learn how to communicate, debate, for example? Where did you learn that communicator skill? It's a question from the audience.
Yeah, and that's a good question. I don't think when I was at Long Beach, there was no public relations, at least I wasn't aware of any public relations club like PRSSA presently. And by the way, I've been if I can diverge for just a moment, I've been a judge of the Bateman Public Relations Competition for undergraduate students. And though I can't vote on any submissions that Long Beach students prepare, I've been very, very impressed with the public relations work of the students at Long Beach State. They've done some fantastic work. Okay.
They are amazing.
Yeah, no, I'm very, very impressed. Unfortunately, I have to disqualify myself from voting, but so no, I wasn't part of any clubs. I think I took one course in rhetoric or speech making, something like that. But really, it's something that just over time, you just have to develop on your own, I believe.
Finding your voice somewhere,
Yeah, definitely.
Do you differentiate between PR and communications?
Not really. communications is very broad, and it can encompass advertising, it can encompass digital communications, traditional PR. But I think what's important now is that as a public relations practitioner, you need to know all of these areas and be conversant in how advertising works and certainly digital communications. It's much more now about there's a problem that a client or company has, and how can you as a communicator solve that problem or help them address that problem, not just by media relations or traditional media or advertising. It's just, communication techniques generally.
Definitely. What is it like living in New York pre-post pandemic?
Oh boy. Pre-pandemic, everybody was happy. It's different than Southern California. We rely on public transportation a lot more. I can walk to the train and I can be in New York City in half an hour, assuming they're running on time. So we're much more, I would never drive into the city, whereas probably most people in Southern California who work in LA probably drive into LA. I haven't been around there for a while. That might not be true, but I think people use their cars a lot more than we do here. So that's one difference. The pandemic, things were just shut down. I can't believe it, but for months on end, we literally went nowhere. And certainly we wouldn't be going into New York City. And now it's opening up. Restaurants are starting to accept people, and the weather's better, so there's a lot more outdoor dining, and things I think will be back to normal, but it's going to take a little while. But it's New York is a fabulous place, and I encourage everyone on this call who hasn't been to New York to visit it at least once. There's lots to see and do.
Yeah, New York, it is beautiful. So I know you have your healthcare communications consulting. What drove you to want to become a consultant? And
Yeah, I'd worked for agencies for, what was it, like 25, 27 years. And I wanted to throttle back and not work the frantic pace that I was working at agencies. And I was able to choose my own clients, choose the work that I really wanted to do. And as the old cliche goes, be my own boss. So and our kids had grown up and moved out. So my wife and I, we didn't have the financial pressure of tuition and, paying for sports teams and all that stuff. So we had a little more financial flexibility. So it was, the right time to do it.
Wonderful. And that's kind of like a learning experience as well, being your own boss, setting up your own schedule. And like you said, you could choose the clients that you really want to work with.
Yes.
What is some advice you wish you had earlier in your career? Something you can offer to a student, an alum, starting their careers in public relations today?
Yeah. I think the couple things. Write as much as you can. Take writing courses, either at the university or elsewhere. Just write. Do a journal, do a blog, do whatever you need, just to get your in the mental frame of mind to be able to write quickly and accurately. That's one. The second is, if you're a public relations student at Long Beach or elsewhere, learn other disciplines, advertising, direct response. Don't niche yourself into just simply public relations. It's broader. You're more sellable, I think, if you have a broad array of skills. And then thirdly, as I said at the onset of this call, learn about the world. Take courses in economics and global affairs. other courses that can help you learn about people in not just the public relations setting, but other settings as well.
Wonderful. Well, Michael, we are up against time. I thank you so much for chatting with me today.
You're welcome.
Before we go, any last final observations you want to share with our students and our alums who might view this video in the future?
Sure. You know, I think I can leave with just a couple things. The communications arena is wide open. There are so many opportunities, challenges for sure, but there's tremendous opportunities. People are hungry for information. So there's always going to be room for good communicators. And two, healthcare is probably the most dynamic area in our economy. And the breakthroughs that we're seeing both in medicine, in ways of paying for treatments and so forth, these brand new horizons are going to give communicators tremendous opportunities as well. So go get them.
Yes, go get them. If anyone on the call wants to connect with you, are you okay that they reach out via LinkedIn, or are you okay if they email us and then we'll connect them with you?
Oh, absolutely. Sure. I'm happy to talk to anyone.
Wonderful. Thank you so much.
You're welcome.
Oh, sorry. Well, before we go, I want to thank everyone for joining us today on this call. We encourage you to visit our webpage and follow us on social media. And again, if you would like to connect with Michael, please email us at alumni@csulb.edu, and we will make sure to connect you. We thank you so much for your time, and have a great day.